Well, it's a rainy good day for this, I think. And my friend, Dr. Peter Goodman, is going to talk to us today about obesity as a disease. And you might remember he was here last year doing the channels of Mars and the gastrointestinal tract. And from my experience being on this committee, he made a real hit. And so I asked him back, and his wife is here, Amy Goodman, who's one of their best friends. And one of our other best friends is late, and she always is, so nothing happened. And so I want you to know that you probably will recognize some of this from last year, that, for instance, Peter went to TJ. And so there are probably a lot of people at Cedarfield who went to school with him at TJ. And then he went on to University of Richmond, University of Virginia. You can see where my loyalties are. And got a BA in English. He graduated with a distinction, which doesn't surprise me. And last year I told everybody one of the unique things about Peter and his college experience was he actually had William Faulkner as a professor. You might remember he taught at Richmond during that era. And then Peter must have been cramming real hard between reading Faulkner's books, because he immediately went to medical college thereafter. So I imagine he was cramming in some hard science somewhere. Then he went to Sinai Hospital for his internship, and back to MCV for his residency, and up to Washington to Georgetown for his fellowship in gastroenterology, which would remain his field. And he would practice medicine for about 39 years. And since he retired almost 10 years ago, I haven't seen him stop running since. And you'll see that he's been working at the Science Museum on different projects, and as a teacher, definitely a popular University of Richmond OSHA lecturer. And he's been at the Medical Society of Virginia and the American, I've got my lines. I looked up to see if Linda Vick was coming in, and I messed myself up. But he's lectured all over the place and won all kinds of awards. And he practiced at Richmond Memorial Hospital, chief of medicine, and subsequently at Bon Secours Memorial Medical Center. He has a unique distinction of being a private practitioner, because I'll say this, I'll interpret this. He didn't want to fool with insurance companies any more than he had to. So he wanted to practice medicine. And he was a happy trooper. And he told me I could list some of these apothecary bottles and devices that fill his home, like 3 or 4 rooms that I know of. Miller's snake oil, DeWitt's little early risers. You can imagine what that might be. Lightning hot drops that contains a lot of chloroform and ether and alcohol. No relief, no pain, chocolate-coated tablets containing belladonna and strychnine. Don't know why. And then the antelope horn is this thing he has. It's a horn. It's a treatment for impotence. So to take care of that problem, he has saltpeter, who quiets it all down. Is that good enough, Peter? Dr. Peter Goodman.
Sally failed to mention an important point in my history. I was the treasurer of my fraternity, and I purchased a monkey. So we had a monkey for about a year at the fraternity house. Somebody asked me if it was a mess, and well, the fraternity house was a mess, so there was no difference. I'd like to first thank Sally Wood and Georgia Brown for inviting me back to talk. It's a pleasure, it really is. And I wanted to thank the program committee for their due diligence in trying to herd cats and get speakers. Let's give them a round of applause. It's a privilege and an honor to be back here talking. I gave a talk previously at Cedarfield, and I was most impressed by the audience. You come here because you want to learn. You're intellectually curious. You're not here to gather points or credits or a certificate. You're here because you're interested in learning. And this, in turn, makes you a more interesting individual. The speakers at Cedarfield do their talks pro bono. They don't get any reimbursement. They talk because they love their topic and they love to teach. And so we have a beautiful combination, a beautiful marriage of people who want to learn, and we have people who love to teach. And you can't ask for a better combination. When one gives a talk, the speaker should have a definite objective, what he or she would like to accomplish. And what I'd like to accomplish today is to give you a couple of pearls, little pearls that you can put in your pocket, and when you leave here, you can say, I'm a little bit smarter. I know a little bit more. And so if I accomplish that, I will think of my talk as being a success. The title of my talk is New Thoughts on the Problem of Obesity. Last month, in the Journal of the American Medical Association, it was stated that 42% of the adults in this country are overweight. My practice was limited to gastroenterology. I was a solo practitioner in the St. Mary's office building, and I was the happiest doctor in the building. I enjoyed my patients. They were members of my family, you see. And when they called at night, I knew who I was talking to, and they knew who they were talking to. But the problem of obesity I found in the office to be really a challenge, a frustrating challenge. My talk today is going to stimulate a lot of questions. It'll also stimulate some controversy. I'd like for you to hold the questions to the very end. Now, let me start off with a question. Think carefully. Raise your hand if you think that the primary cause of obesity is lack of self-restraint and willpower. Raise your hand if you think that's a strongly, okay? Well, you're wrong. You're wrong. This morning's presentation deals with the disease that we call obesity. Notice that I use the word disease because obesity is a disease. As reported in the Pew Research Journal last month, 60% of Americans believe that obesity is not a disease, but simply caused by a lack of willpower. The fact is that disease and hereditary contribute to 60 to 70% of the problem of obesity. Hereditary. Now, according to the AMA, what do you think is the most preventable measure an individual can take to maintain good health? The most preventable measure. And I'm going to give you 3 choices. Number 1, have a complete physical examination every year with blood work, appropriate laboratory tests, and vaccinations. Number 1. Number 2, second choice, avoid stress, getting the proper amount of sleep, getting the correct amount of exercise for your age. And number 3, control one's diet. Now raise your hand if you think that the number 1 measure a person can do as a preventive measure to maintain good health is to have a yearly physical exam, blood work, vaccinations to maintain good health. Raise your hand if you think that's the most important. Wrong. Okay? Second, raise your hand if you think that the preventable best measure to prevent disease is avoiding stress, getting the proper amount of sleep, and getting the proper amount of exercise for your thing. Wrong. You're 0 for 2 now, okay? According to the AMA, controlling one's diet is the best thing an individual can do as a preventable measure to maintain good health. Controlling one's diet is the best thing you can do as a preventive measure to maintain good health. To quote the AMA, our diet is the leading cause of a preventable measure one can do to keep healthy. According to Shakespeare, the fault in Brutus is not in our stars, but in ourselves, that we are underlings. We are the problem. I was an English major in college. I have to quote Shakespeare. Obesity contributes to the risk of hypertension, stroke, myocardial infarction, diabetes, and actually some forms of malignancy. According to a study published in the journal Cancer, obesity is a significant contributor of 4% of cancers, including postmenopausal breast cancer, cancer of the liver, colon cancer, and prostate cancer. A Rhodes study published this month reported that less than 30% of women are aware of the fact that a healthy diet can prevent breast cancer. It is interesting to note that the percentage of adults trying each year to lose weight increases with age and education. It's simply the smart thing to do, trying to control your diet. While some 800 million people suffer from hunger in the world today, more than 2 billion people are overweight and obese. According to the journal Nature, there is 2.5 times as many people suffering from obesity than from hunger. Now, one of the problems that we have today is that we belong to the Clean Plate Club. Our mothers told us that the meal is not over until the plate is clean, you see. And that there are some starving children in some foreign country that are hungry, and here you are leaving food on your plate, you see. And too many of us belong to the Clean Plate Club. How many of you, raise your hand if you left food on your plate this morning after breakfast? One hand up. Proud of you. Now, how does one lose weight? For every complex problem, there is a clear and simple answer. And it's wrong. It's wrong. Obesity is a very complex disease, and it needs treatment. And the fact that there is no simple treatment for obesity shows you how difficult it is to treat it. Now, if you have pneumococcal pneumonia, I give you a shot of penicillin and you're cured. There is no single one treatment for obesity. Recently, a New York Times reported at a conference, and there was a conference on the best diet for obesity. And there were various approaches: intermittent fasting, low-carb diet, periodic fasting, as I said before. And really, in my mind, the best diet is the diet that you can stick to, one that fits your personality and your mindset. Out of frustration, patients now have turned to a shot or a pill, medications that will cost over $1,000 a month for the rest of your life. And we're going to talk about that later on. Now, listen carefully to this. During my training at Georgetown, I was taught by a Mayo Clinic trained professor of gastroenterology the following, quote, if you reduce your caloric intake by 500 calories a day, you will lose 1 pound in 1 week. Dieting 500 calories a day, reducing your diet 3,500 calories cut out in 1 week will lose 1 pound of fat in 1 week. Now, to quote my professor at Georgetown, it is a simple truth rule of thermodynamics. If you burn more calories than you consume, you will lose weight in direct proportion. Now raise your hand if you think that this is correct. Wrong. You haven't learned yet. Wrong. The statement is completely false. If the human body was a machine and calories were equivalent to energy, the statement would be true. But we are not machines, and the statement is completely wrong. If you cut out 500 calories a day, you cut out 3,500 calories in a week, you will not lose 1 pound. Now, I'm going to give you and show you 2 patients to show that this statement from my professor at Georgetown was incorrect. 20 years ago, there was a TV show called The Biggest Loser on NBC. Any of you remember that show? Good, good. The winner of the show, of the grand winner, was a gentleman by the name of Danny Cahill. Danny Cahill is a 46-year-old gentleman who weighs 430 pounds. Danny won the NBC show, The Biggest Loser. He was the champion of all contestants 20 years ago. He lost an astonishing 239 pounds in 7 months. 239 pounds. At an initial weight of 430 pounds, Danny was so heavy that any one of you could fit into one of his trouser legs. He had to sleep on a recliner to avoid sleep apnea. Under the auspices of the TV show, he went on a diet. After 7 months on the diet, he weighed 191 pounds. He lost 239 pounds. He lost 56% of his body weight. He was lean, athletic, and handsome as a model at the end. To quote Danny, I got my life back. I feel like $1 million. He stood on the stage at NBC and confetti fell from the ceiling. His family ran up to him and gave him a hug with 2 hands. The audience screamed. He was the poster child for what can be done to lose weight. Cahill left the show in Hollywood and went on a tour of the country, courtesy of NBC. He was on the Jay Leno show. He heard from fans all over the world. And again, he was the poster child for successful weight loss. To quote Danny, I looked at myself and think I am horrible. I am a monster. I am subhuman, when he weighed 439 pounds. Danny picked the show, The Biggest Loser, because he felt that this was the best way he could lose weight. He applied 3 times, and only on the 3rd time was he selected as a candidate. The contestants at The Biggest Loser underwent medical tests prior to going on the program to see if they could endure the rigorous schedule that was set before them. Dr. Kevin Hall at the NIH studied Danny Cahill prior to going on the TV program. Danny's metabolic rate, his metabolism, prior to going on the show was completely normal. The NIH defined metabolism as the number of calories that you burn at complete rest. At a weight of 430 pounds, raise your hand if you think that Danny's metabolism was completely normal. Wrong. One more time. Wrong. Danny's metabolism was normal. It was completely normal. The contestants on the show were sequestered at the Biggest Loser Ranch, and they exercised 7 days a week, 7 hours a day. The diet that they were put on was no special diet. It was just calorie restriction. They lost weight, and the weight loss was massive. Many medical authorities questioned the safety of the program, and the show was subsequently taken off the air because of that, and there were lawsuits regarding the show. After 7 months at the ranch, Danny appeared on the show, losing 56% of his body weight, losing 239 pounds. He lost an amazing 8 pounds a week, going to 191 pounds. Now, just prior to appearing on the show, Danny was surprised and somewhat embarrassed. He was given a custom-made expandex suit to wear. The suit was designed to hide the rolls of fat and tissue that was left when he lost all this weight. He looked like a deflated balloon. Now, at a weight of 191 pounds, remember, his metabolism was normal at a weight of 430 pounds. At a weight of 191 pounds, what do you think his metabolism is now? Raise your hand if you think his metabolism, the rate at which he burns calories, is still normal. Raise your hand. You got the idea. You got the idea. Good, good. His metabolism has slowed. His metabolism is slowed so that he will regain weight. The body is trying to regain the weight that it had lost. Dr. Hall was quoted as saying, quote, "I was blown away by the data." Dr. Michael Schwartz, an obesity and diabetes researcher and professor of medicine at the University of Washington, reviewed the data. And I'm quoting Dr. Schwartz. "The key point is that you can be on TV, you can lose an enormous amount of weight, you can go for 6 years, but you cannot get away from your basic biologic reality. As long as you are below your initial weight, your body is going to try to get it back by slowing the metabolism." Furthermore, Danny found that he must exercise every day to keep his weight down because his metabolism has slowed down. Now, leptin is a hormone, and a leptin causes you to suppress your appetite. Raise your hand if you think that Danny's leptin level was low, and that is why he ate so much. Excellent, excellent. His leptin level was normal, perfectly normal, you see. So leptin was not the cause of his obesity. Now, after losing 56% of his body weight, his leptin level dropped. It fell. And it fell because the body is trying to regain the weight he lost. And he was always hungry. What is surprising and also what is somewhat distressing is even though most of the contestants lost an enormous amount of weight, their metabolism and their leptin levels never returned to normal. Sean Alder, a 56-year-old pastor, came in second. He lost weight going from 444 pounds to 289 pounds. 6 years later, he weighed 458 pounds, representing a weight gain of 14 pounds. To quote Mr. Alder, it's kind of hearing that you have a life sentence. What is the cause of obesity? Now, in some individuals, it's hereditary. As I said, approximately 40 to 70% of people who have weight problems have a genetic predilection for it. Some individuals under stress will eat compulsively, while some individuals under stress will lose weight. Some individuals under stress can't sleep at night and require sleeping pills. Other people under stress crawl up in a fetal position and want to sleep all the time. We are so individual in our approaches to various problems. Of course, there are medical problems that contribute to obesity. Diabetes, thyroid disease, medications add to the problems of obesity. Classically, it's prednisone, steroids, make you eat more and you'll gain weight. Now, studies have shown that consuming most of your food early in the morning is best for your health. Your mother always told you that breakfast was the most important meal of the day, and she was 100% correct. Blood sugar is best controlled early in the morning. Nevertheless, what do? We eat our largest meal at night and then go to bed and have heartburn and have reflux, and we take our Nexium or Prilosec because of our indiscretions eating late at night. Now, if you were going to drive to New York City, you fill the car with gas in Richmond before you get to New York. You don't fill the car with gas when you get to New York. Eat breakfast. You don't get fat eating breakfast. Now, when you're at a restaurant, take a look at an obese person and watch how they eat. The obese individual tends to eat rapidly. The fork never leaves their hand. The meal is over quickly, and thus they really don't take the time to enjoy the meal. As previously mentioned in my talk, leptin is a hormone that causes you to feel satiated, causes you to feel full. And leptin doesn't have time to be secreted and get to the hypothalamus in the brain to tell you that you're no longer hungry. You're eating too fast. Eat slowly, put the fork down, leave some food on your plate, you'll eat less. Now, let me talk about the new magic. The new magic pills and shots for obesity. Ozempic, Mounjaro, Zebound, all must be taken by an injection. The drugs do not work for everyone. Some few people do not lose weight on the medicine. Ozempic, a Novo Nordisk drug, was approved for the treatment initially for diabetes. This was in 2017. It must be taken by an injection. There's now an oral formulation for Ozempic, and sales for this drug have skyrocketed. Novo Nordisk has announced that they are going to build a manufacturing plant in North Carolina to compete with these generics that are imitating the drug. They are going to spend $4.1 billion, not million, $4.1 billion in constructing this plant in North Carolina. Wegovy, a higher dose and a stronger medication than Ozempic, was approved for adults and for children aged 12 and above in 2021. It must also be given by an injection. And you take an increasing dose every month for 4 months. And by the 5th month, you're at a stable dose, and you take this for the rest of your life. These drugs had a peculiar effect on the fashion industry. On the front page of the Wall Street Journal this past June, there was an article, quote, "Ozempic is spurring brands to downsize clothing. Slim down customers are buying new outfits because they have lost weight. The fashion in large sizes is changing. Retailers also report that the shift is unlike anything they have seen before, with size 12 clothes being reduced to size 6 and 8. The benefit in the clothing industry is twofold. It produces smaller sizes and less fabric, and the weight loss is causing individuals to buy new clothing." Now, a new drug has come out called Moderna, and it is possibly the most potent of all the class of drugs in this category. The weight loss is most impressive. How do the drugs work? Well, they work by mimicking a hormone primarily found in the intestine, and they work 2 ways. First, they mimic the action of hormones to produce a feeling of satiety. They also slow the emptying of the stomach while regulating the blood sugar. The drugs stimulate the pancreas to release insulin to lower the blood sugar. They produce a significant weight loss, and they prevent type 2 diabetes. They lower the cholesterol, and they are beneficial for patients with atherosclerotic heart disease. By slowing down the digestive process and the ability for the stomach to empty, the patients feel full, they feel satiated, they eat less. And there's a peculiar response to this. Patients, come Thanksgiving or Christmas or the holidays, they don't want to eat. And so what do? They do not take their drug on those days. There is a response, of course. They immediately start gaining weight as soon as they stop taking the drug. Now, let me give you a new way, a possible new way to change medical thinking. When an obese person comes to your office, to my office, and they have hypertension, I give them a drug for the blood pressure. When they have high cholesterol, I give them a drug for their cholesterol. When they have too much fat in their liver, I give them a special diet. And of course, I tell them to exercise and lose weight. Decades of experience show that the patients will be on all 3 or 4 medicines for the rest of their life, because they do not exercise, and they really don't lose weight. Obese patients have problems with joint replacement. They wear out the new joint, and after 10, 15, or 20 years, the joint needs to be replaced. However, by starting the patient on Ozempic or Wegovy, additional to diet and exercise, you find that the physician now can treat the diabetes, the hyperlipidemia, the fat in the liver, all at one time. Now you say, well, they have to be on the drug for the rest of their life. Well, they also have to be on the drug for their cholesterol, for their blood pressure, for their diabetes for the rest of their life. So either way, you're going to be on medicine for the rest of your life. Let me tell you about a surprising effect where patients take Ozempic, they lose the desire to drink alcohol. No one knows exactly why, but they really don't feel the desire to drink alcohol. I've told you a lot of nice things about these drugs, and let me tell you some of the bad things. Let's get it balanced. Medical history is filled with ideas that have been wrong. We treated women for menopausal symptoms with Prempro, a hormone. And this was designed to prevent heart disease. Instead, patients had an increased risk of blood clots, stroke, and cancer on this hormone replacement for menopause. We treated patients with a high fiber diet for reducing risk of colon cancer. It didn't work. We treated patients with ulcers with Maalox and Mylanta. We gave them a special bland diet called the SIPI-1 and SIPI-2 diet. And we also gave them Librium and Valium for the stress causing their ulcer. The patients loved the Librium and the Valium. And what happened? The ulcers did not go away. And we were completely fooled. And a man by the name of Barry Marshall said, ulcers are caused by an infection, H. pylori. Ulcers is an infectious disease. Now we treat ulcers with antibiotics. So, be careful about the new magic that I'm talking about. Nobody knows what happens to people who take Ozempic for 10 years. Obesity carries a stigma. If you have heart disease, people feel sorry for you. If you have diabetes, people feel sorry for you because you have to go on a diet. But obesity has a stigma, and no other medical problem that I know of has this stigma. Moralizing about obesity because you're lacking self-control and you don't have self-restraint is not the answer for obesity. Again, obesity is a disease that needs to be conquered. It's a disease that needs to be treated. Now, the new medicines do not cure obesity. I've talked about some of the remarkable things, again, that these drugs do. Let's talk about more of the side effects. Again, you need to take the medicine for the rest of your life. You can't stop it. If you stop any of the drugs, the diabetes comes back, the cholesterol goes up, the fatty liver returns, the blood pressure rises. Wegovy costs $1,349 a month. Moderna costs $1,069 a month. Zebound costs $1,059 a month. Many insurers do not cover it at all, or there is a large copay. And Medicare is currently negotiating the price on these drugs. Some individuals want to take the drug strictly for cosmetic reasons. And of course, there is no insurance coverage for that. Patients are disappointed when they stop losing weight on the medication. They may lose 20 or 30 pounds, but they want to lose more. And thank goodness there is a stopping point. You don't continue losing weight. You plateau on the medication. Patients who have diabetes have a higher plateau than patients who do not have diabetes. Again, the body is fighting desperately to regain the weight that you've lost. Even in bariatric surgery, there are problems of some weight gain afterward. Now, let me tell you about a cosmetic problem on Ozempic, and it's called the Ozempic face. The face of patients taking Ozempic looks wrinkled. The face looks old. They lose the fat in their cheeks, and the wrinkles that they had previously are bigger now. And the patients want to have filler injected in these wrinkles. And their chin hangs down after losing all the weight. So there is a boom in plastic surgery for patients taking Ozempic, the Ozempic face. Now, this is completely a minor problem to some, but it's a major problem to others. Now, the stomach, as I said, stays full after taking this medication, and you feel full. Supposing you're in an automobile accident and you're taking Ozempic, and you need emergency surgery, and so you undergo anesthesia, and your stomach is still full of food contents, and you aspirate during your surgery. And that is a risk factor with these medicines. So you need to stop the medicine a week before any surgery, elective surgery. On the other hand, for emergency surgery, there is a significant risk. Now, like all drugs, they have other side effects. Some people get diarrhea, some people have constipation, kidney stones, gallstones. There's a loss of muscle. You lose muscle mass while on these drugs. And you may feel a little bit weak going up the steps. In July of this year, it was reported that patients with type 2 diabetes taking Ozempic or Wegovy are at increased risk for sudden blindness in one eye. This is caused by an acute decrease in blood supply to the optic nerve. The incidence was 8.9% in diabetic patients taking the drug, while only 1.6% in patients who do not take the drug. In diabetes, this is the most common cause of blindness. It's permanent, and there is no treatment. Again, we don't know what the other side effects are in 5 or 10 years. Let me conclude my talk by saying that I have told you many things. A caution. Some of the thoughts and treatments that I've discussed in the management of diabetes will be proven wrong, completely wrong, and they shouldn't be chiseled in stone. Please note that I have never mentioned the word cure. Obesity is the disease that needs treatment. It's a complex disorder, and that there are multiple modalities of treatment for obesity because there is no single one treatment for everyone. However, we are getting smarter. I'll be glad to take questions. Thank you. Any questions? Yes?
It seems to me that there will be a lot of litigation now. The attorneys too will be happy.
I'm sorry?
I said, it seems to me, I forgot to take care of this. It seems to me
that there'll be a lot of future litigation here because people are having these ramifications. So we're talking about the plastic surgeons are benefiting and the designers in New York City are benefiting. I think the attorneys will end up benefiting.
You know, we have a thing called your BMI, your basic metabolic index. This was, obesity is defined as having a BMI of 30 or greater. BMI is defined as your weight in kilograms divided by your height in meters squared. This was designed 200 years ago, and it is an incorrect measurement. And I'll tell you why you should not use a BMI. First of all, it was only related to men. Caucasian men. Arnold Schwarzenegger, who was the Mr. Universe, if you remember, with his massive muscles in his chest and his thighs, and he had a waist of 36 inches. And according to his BMI, he was obese. He was obese when he won Mr. Universe, because the BMI was high because of his muscle mass. And so it is not a good indication of your status as being obese. There's a new measurement that's coming out now called the Body Roundness Index, where your weight is in kilograms divided by the square of your circumference. And that is a better measure than your BMI. So we're getting smarter, and we've got to be able to give up some of the old ideas that we had. Any other questions?
Fern has a question.
I have a question. You were talking about you were talking about severely obese people at 400 and some pounds, and things like losing 3,500 calories a week not working for them. But if you just need to lose 10 or 15 pounds, is something simple like cutting back on your caloric intake and increasing your physical activity, does that work for those people?
The question is whether if you lose 10 or 15 pounds, does the body still want to regain the weight that you previously were? And the answer is yes, but it's not as strong. So losing 10 or 15 pounds is quite a reasonable thing. And again, in those cases, diet and exercise are a better answer. Yes?
I was reading recently that many teenagers are now turning to some of these new drugs for cosmetic reasons. Is it, how do they obtain these drugs? Does it have to be given by a pediatrician?
Let us say you want to get on Ozempic and your insurance company is not going to pay for it. So you go to a compound pharmacy, and there are compound pharmacies now offering a generic form of Ozempic. The problem is that these drugs, the generics, are not FDA approved. And you're taking a chance in taking these drugs. Now, you ask, how do these manufacturers of these generics get by with it? They get by with it because there is a shortage of drugs. And because there is a shortage of Ozempic, that is why these generics are coming out. You could buy them literally through the mail. How good they are, how effective they are, how safe they are. They come with a needle and a syringe. You take your chances.
How do you normalize those hormones that you were talking about without, so that you can have a normal metabolism after you've lost weight?
After you've lost 20 or 30% of your body weight, your metabolism will never come back to normal. Your leptin level will not come back to normal. And that is why you regain the weight. And even when you regain the weight, as pointed out by Dr. Hall, the leptin level and the metabolism is never going to be what it was prior. That is why drugs like Ozempic need to be taken for the rest of your life. And it is a difficult problem.
What about programs like Weight Watchers, who's touted as having a great amount of success?
I'm sorry?
Weight Watchers, what about programs like Weight Watchers, who's been touted for years and years to have a lot of success?
Weight Watchers is going out of business. Weight Watchers is going out of business. Their primary sponsor, blocking on her name, no longer is a proponent of Weight Watchers. I forgot. Oprah Winfrey no longer works with Weight Watchers.
So is it hopeless?
Is it hopeless? No. You know, again, we are the problem. And we want a simple answer. And we get frustrated because we don't have a simple answer, but there is an answer, and it's due diligence. The fault, de Brutus, is not in our stars, but in ourselves. We are the problem. And we're only asking you to lose 10 or 15 pounds. We're not talking about 400-pound weight loss. But, you know, little things like eating a good breakfast and not eating a big meal at night, leaving food on your plate. See if you can do that. At lunch today, walk away with food on your plate. You're going to find that is very, very hard to do. You know, we have a certain mindset that's inculcated in us.
Question. In your research, did you find anything with the functional MRI and things like psilocybin? Any research on the hallucinogenic drugs maybe helping sometimes?
I'm sorry. I didn't hear it.
The hallucinogenic drugs like psilocybin and things like that, have you done research on drugs that help with changing your behavior?
The drugs are not the answer. The drugs are treatment. And if you think of it, the drugs are simply treatments. They don't give you an answer to the problem. And again, we don't know what happens to people who take Ozempic for 10, 15 years. What about their muscle mass? You don't only lose fat, you lose muscle. What happens to these individuals? You know, it's a tough problem.
Well, what about, I'm hearing from the generation below us, about forget this, eat your breakfast. You should fast for 12 to 14 hours a day.
I don't think fasting is the answer to the problem. I think, again, for every complex problem, there's a clear and simple answer, and it's wrong. You can't go through life fasting. Some people fast for every 4 days, they go on a fast. Some people fast for 3 or 4 days. You can't live your life that way. So I don't approve of that approach.
Peter, this might apply to our age group more than others, but so many of us are having to have joint replacements. And if you're overweight, they're saying we won't operate on you unless you lose 50 pounds. So what's a reasonable way to deal with that without causing more trouble than the replacement itself?
The question is that if you're 50 pounds or 60 pounds overweight, the orthopedist does not want to do a knee replacement on you. The cardinal rule in medicine, the cardinal rule that every physician should aspire to above all else is non primum nocere. First, do no harm. First, do no harm. And an orthopedist is unlikely and unhappy and will not do a knee replacement on someone who's 50 to 70 pounds overweight, because he knows that the risk of infection, complications are immense. All right, knowing that, perhaps the answer is Ozempic for those individuals, because they simply cannot exercise and they cannot lose weight because of their knee. So it is a reasonable approach taking this type of medicine in that type of situation where the benefit outweighs the risk.
Any more questions?
I think we solved all the problems.
Well, he always hits the home run several times over, and I'm so proud of him. And next month, we have another speaker, Ed Ayers from the University of Richmond, who had been president for years, and he is a history expert, and he will be talking about a certain period in time, mid-century, 19th century. And he is an excellent speaker, and I just hope you come on out and see him too. Yeah.